one of the factors that leads to prematurity deliveries is teenage pregnancy. Why is it so? With prematurity delivery, where teenage pregnancy contributes, is because with the teenagers, all the sensory organs, then the pelvis, everything there is not yet fully ossified. So meaning that once it is not fully ossified, it can't accommodate the fetus to up to that extent of a normal uterus, where these babies would mature properly, coupled with the other factors, things like stress, because this is a teenager who is still a school-going age, who would have been in school, but what made this person or this girl to come out of school might be other factors, where as parents we also sometimes contribute to their coming out from school, where they will demand for things, necessities that we would have provided them, but because we do not provide for them, it now prompts them to go out and look for what they would need. So it will now push them to have early sex, which will now lead to pregnancy, and then it ends up with that stress. Of course, things will not be okay, and then this child will get into problem, where I call it a child because they are not really supposed to have delivered at that period where they got pregnant. So it is really something that is very key here. And for us here, most of the premature babies that we have been having have been delivered by these teenage pregnancies. So the teenagers that we have here, most of them are being referred to our facility, where we get all the prematurity births and the premature babies. Most of them, at least the number that we have here, 10% of the premature deliveries are by the teenagers, and there are also referrals from lower level facilities.
We receive a lot of prematures. Currently, they are being managed at the neonatal unit at NICU. Most of the babies, the neonates, will receive referral from other health facilities. So we have realized that some of the cases are referred late. But then, of recent, there was communication that all the mothers who are, for example, from the lower health facilities, all mothers who they suspect to be having premature babies are supposed to be referred immediately, so that when they are delivered from here, easy management can take place. Then we have also advised the mothers to attend antenatal care, such that when those cases are realized early, they can easily be managed. There are some supplements which mothers take when they are pregnant. This would also help, and some medications.
Examples of those medications? Okay,
medications which mothers take, like folic acid, Fancida for preventing malaria, then the folic acid, folate for preventing anemia in pregnancy. Those factors can also lead to infections, which can lead to premature deliveries. So those mothers are advised at the grassroots to attend antenatal care, and then some of them they have advised them when they have any issue, they should come to the hospital, whether it's a health center in lower health facility, whereby they are managed and referred to our unit. Yeah, actually, since they have advocated for the issue of referring mothers who we suspect would have premature labor to be delivered from the referral hospital, there have been reduction in percentage of prematures, and the management, the outcome has been okay, as it's about 95% survival of neonates who are prematures at the facility. The layman will say some people have a myth that family planning can lead to prematurity, but that is not the case. There is no evidence that has shown that family planning method can lead to prematurity. Thank you. I talk to mothers to attend antenatal care in time, such that those risks can be avoided. Then there are some social practices which are done in the public. Some mothers, when they're pregnant, they take a lot of alcohol, they smoke, Those are some of the factors which can also lead to premature deliveries. Yeah.
Okay.
Patients at NICU have realized that the earlier, the better. When the patients' children are referred in early enough and proper treatment is given, most of them survive. And secondly, it also depends on the age of the pregnancy. For example, some mothers we have seen at 34, 35, 33, most of them survive, but then there are those extreme prematurities, those who are like 28, 29 weeks. It's really very difficult. Though we have a success of one child who was born at 800 grams. That one has survived. He's now weighing about 12 kilograms.
On the 17th, it was the World Prematurity Day. The babies who are born premature come out when they have low body weight. Also, they have some issues with their organs, like for breathing, the heart, and also nutrition. So there has been a development in medicine where we have areas of specialization to take care of these premature babies. So we have what we call the NICUs, and in the NICUs we have doctors and nurses, midwives who have been trained with special skills in how to handle these babies. And for us in Yumbe, we are very grateful to the government of Uganda, Ministry of Health, and development partners, especially UNICEF, AFC, and Enabel, who have supported us in building capacity, in remodeling our ward, and providing us with the equipment so that we have more space. Initially, after they rehabilitated this hospital, they had created only one NICU. But now with the support we got from AFC and UNICEF, we have created more space, including a space for kangaroo mother care. One of the issues we have in our region are babies who are brought from outside the hospital. Those who are born either at home, those who are born on the way, and those who are born at the lower health facility. They need to be brought into regional referral hospital or in a facility which have the NICUs. So some of them delay. Now the longer they delay, now that is where we have challenges, and we can lose these babies. And then also when we get these babies in our facilities, they need the 24-hour electricity care. When the power goes off, the machine goes off. Some of these babies are on oxygen, others are being on life support. So we also lose them when we lose power. Then we have issues of human resource. But for Yumbe now, we are happy. The government deployed for us a number of health workers, including specialists, consultants, associate consultants, but still we need more. And also we need more space. Now that our services are improving, the patients we are catering, are looking after also are increasing. So we continue to need to improve and expand.